name is Abigail Tan, and over the summer I have been working in Dr. Alcock's lab with the help and supervision of Dr. Farrell Fairbanks, and I have been modeling heart failure in cancer patients with AL amyloidosis. So, cancer and the heart. The field of cardio-oncology is a relatively new field of study that focuses on the way that cancer and cancer treatments affect the heart. It has been found that patients, specifically of multiple myeloma, have been treated of their disease. However, and they live a long, healthy life. However, there has been an association between patients of multiple myeloma and heart failure. So the people who work in the field of cardio-oncology have been trying to investigate whether this relationship is merely an association or whether there is a cause and effect relationship between multiple myeloma and heart failure. So I have been studying a disease called immunoglobulin light chain amyloidosis, or because this name is quite long, it has been shortened to AL amyloidosis, A meaning primary and L meaning light chain. And this is a common side effect of multiple myeloma, as multiple myeloma is the growth of abnormal cells from the bone marrow, and then from these abnormal cells proteins are synthesized, and these proteins are sticky in nature. And because they are sticky in nature, they bind to the organs, causing an accumulation of proteins, and this can lead to organ damage or organ failure, and this occurs primarily in the kidneys or in the hearts. And the heart in particular, AL amyloidosis, can lead to heart failure with preserved ejection fraction, or HFpEF for short. And this is when the ejection fraction, or a percentage of blood that is pumped to the body, is normal. However, there are physiological symptoms that do indicate heart failure. And patients of AL amyloidosis are usually treated with chemotherapy. So there is a similarity in how cancer patients and patients with AL amyloidosis are treated. The heart is quite the complicated muscle, so a paper by Jung and Lee from the Korean Math Society tried to simplify the heart with this lumped parameter model. So starting at the pulmonary vein, the blood goes to the left atrium and then passes through the mitral valve into the left ventricle, passes through the aortic valve into the systemic artery, out of the body through the systemic artery, and then into the heart through the systemic vein, into the right atrium, and then into the left atrium through the tricuspid valve into the right ventricle, and then out through the pulmonary valve into the pulmonary arteries, and then to the pulmonary valve, and then this cycle repeats until the heart fails or until the patient dies. So Jung and Lee used a few concepts from physics in order to implement an ordinary differential equation, and these concepts are Ohm's law, which is Q of T equals delta P of T over R, or flow at a specific time point equals the change in pressure at a specific time point, and this change in pressure is divided by resistance. They also use the definition of compliance, which is V of T equals V of D plus C of T times P of T. This is volume at a specific time equals V of D. V sub D is the dead weight volume, and the dead weight volume is the volume of a specific compartment in the heart when the pressure equals 0. This is added on to C of T, which is the compliance at a specific time. Compliance refers to either the elasticity or rigidity of a certain compartment, and this is multiplied by P of T, which is pressure at a specific time. Finally, they use the definition of volume conservation, which is dV of T over dt equals Q sub in of T over minus Q sub out of T. And this is the change in volume at a specific time with respect to time, and this equals the flow of blood into the heart minus the flow of blood out of the heart. So Jung and Lee combined all of these equations to create an ordinary differential system of ordinary differential equations of 8 parts. All of these equations represent either a compartment or a artery or vein in the heart. So starting from the top, we have the left atrium, then we have the left ventricle, the systemic artery, systemic vein, right atrium, right ventricle, pulmonary artery, and pulmonary vein. So to define some parameters and variables in this ordinary differential equation, we have S, which is states, and this refers to the specific valves in the heart. So this refers to the mitral valve, the aortic valve, the pulmonary valve, and the tricuspid valve. So in order to determine the value of these valves, it is necessary to take the difference of the pressures surrounding these valves with respect to blood flow. If the difference of these pressures is positive, then the value of S is 1. And if the difference of this pressure is negative, then the value of S is 0. Another parameter is resistance, which is the opposition to force. And the resistances at each part of the heart are held constant throughout the course of the ordinary differential equation or throughout the course of the cardiac cycle. And then of course, we have pressure at each vein, artery, atrium, and ventricle. And another variable is compliance. And for the atriums and for the ventricles, compliance changes over time. However, for the arteries and for the veins, compliance is held constant throughout the course of the cardiac cycle. So in order to model a heart, I focused on the left ventricle because patients diagnosed with heart failure with preserved ejection fraction have all been found to have abnormalities in the left ventricle, and this is called left ventricular diastolic dysfunction. And this is the results of the left ventricle portion of the ordinary differential equation. And to put this into context of the cardiac cycle, this point over here marks the start of systole, and systole is the phase of the cardiac cycle where the heart contracts, and then over here this marks the start of systole, and as you can see the pressure shoots up, which is compliant with the definition of systole, because if the heart contracts, it would be expected that the pressure would shoot up. And then the heart relaxes when over here during the phase called diastole, and diastole is the phase of the cardiac cycle where the heart relaxes. And this is the pressure versus time relationship of a normal healthy heart. And I modeled a healthy heart first to make sure that my model was working before I tried to model a heart with AL amyloidosis to predict heart failure. And then the figure on the left shows patient data from a paper by Luong, and I tried to match my ordinary differential equation to match the patient data, and I was successful in doing so. And these two figures show the pressure-volume relationship in the left ventricle throughout the course of the cardiac cycle. And then afterwards, I tried to find the relationship between pressure and time in a heart with AL amyloidosis that eventually leads to heart failure. And to do so, I ran a parameter sensitivity test, and I tried to change the values of resistance in my ordinary differential equation, but I was not successful in finding changes to the pressure versus time relationship. However, when changing the values of compliance, I was more successful in doing so. And as you can see, the range in pressures is much lower in a heart with AL amyloidosis than a normal healthy heart. And now I have the pressure-volume relationship in a source. This is also in the paper by Luong. And I have the pressure-volume relationship that I have tried to create in a healthy heart and in a heart with AL amyloidosis. And while it doesn't exactly match the paper, the relationship is kind of similar to the paper. And as you can see, the range in pressures and the range in volumes is much smaller in an AL amyloidosis heart than in a normal functioning heart. And yeah, so I would like to thank Jung and Lee, and that's the paper that I derived my ordinary differential equation, and then Luo, who wrote the paper where I derived my patient data from, and then Dr. Altrot and Dr. Megan Farrow-Fairbanks, who have helped me throughout the course of my project, and Dr. Kemo, who helped with my coding. Thank you.